Hi, everyone. I'm Dr. Susan Brown, Director of the Center for Better Bones. Most of you all know me. I welcome you. I welcome everyone in the Better Bones community. Today, I'm here with Gina Galli. Gina is our wonderful assistant. She helps me with all the clients. She does all our client service. And she also is the developer of Exercise Evolution, which probably many of you have used. Today, Gina and I are going to chat about our experiences working with women and their concerns in bone health. We're constantly thinking how we can provide better service, and we're going to chat about what we see. I, for example, dedicated myself to bone health some 40 years ago when I realized I had a bone health problem, and I have been relentless in finding ways to empower women around their bone health. Over and over again, I see that women are confused. I see that they're fearful. They go to the doctor says, get a bone density test. Just on seeing the bone density test, the doctor says, take a bone drug. It's an injustice, actually. And what's mostly fired me up is there's no real medical attention to looking for the causes of the bone loss or how one can rebuild bone health naturally. We have lots of data. There's lots of ways you can rebuild bone health. And it's really important that you understand what's happening in your situation. The whole Better Bones, Better Body program is about those 6 steps that you need to do to really master understanding of your bone health. So when I see women, and I've seen thousands of women over the decade, I see fear, confusion, and I really see a disempowerment. And we're here to change that, actually. That's been my life's work. Gina, you see a lot of the clients too. What have you noticed? What are kind of trends, kind of thoughts? What's happening with the women?
Well, often, what draws many people to us as a client is they want an alternative to
Mm-hmm.
what they're presented with. Often the first line of action is to address it with a drug of some sort.
Right.
And, they're given very little information or education of what they're facing when
Get it.
they do take that line of action. So, they start to search on the internet and want to find more information and alternatives, and they come upon us.
All
And
right.
they want a natural approach, and they want education, and they want understanding because they're filled with such fear and
Right.
anxiety and hopelessness, and they want to feel hope. And I think that's what we do is I think education and information is power, and they feel more hopeful once they
Yes.
have the understanding of really what their possibilities are. We give them possibilities and hope and a better you know action that they can take.
Yeah,
So
a real action plan. In fact,
mhm.
I would say practically all of my clients come out of the appointment saying, I feel better. I'm not so worried. I'm more hopeful. And that's one of the major things we try to do is through applying the science of really understanding what that bone density means, what it means if you have excessive bone loss, how to assess if you have excessive bone loss, and what you should do. Our whole program is so empowering. So it seems like you see the same kind of trends I see of fear, and this is what and a fear in being unjustly treated, really. So
Right.
that has spurred us on to continue every single day looking for better ways to help everyone become empowered around their bone health. As most of you know, I've written books on the topic. We have 1,000 articles on the Better Bones, Better Body website. I mean, really a lot. We have hundreds of videos, and we've also developed a new system of educating people that's been a lot of fun, a new way of working with women. And these are the retreats. The Love Your Bones, Love Your Life retreat. We gave one in Sedona. It was great. I'm going
Oh,
to
it's
ask.
yeah.
I'm going to ask Gina to reminisce a little. We gave one in Myrtle Beach. We gave one at an ashram in Pennsylvania. It's a great opportunity to learn every single step of the program and to build community. And now, because of COVID, we're going to give the retreat online, which is in a sense a benefit because everyone all over the world will be able to join the retreat, and it's very inexpensive. And we're going to have every single material, every handout, all the notebooks we use in other retreats. Hey, Gina, what did you notice in the other retreats? What are some of the highlights? What are the things you remember from some of the other retreats?
There's so many great, I think, attributes that, I can reflect upon, the retreats of, just an amazing community of people that we have drawn together,
Right.
and just feeling that, love, emotion, and support at the
Right.
end, that we've come together and they've been heard. They got
Right.
to
Right. Right.
tell their story. They got to be heard. Got to be cared about. We had such great fun times. I loved leading the yoga
Yeah.
classes and
Yeah. Yeah.
exercise classes. And that's really in Myrtle Beach is where, the whole idea of exercise evolution was born, after our first retreat, and the feedback of, having a resource of exercise and yoga that was specifically designed for our people, for our
Right. Right.
clients.
Right.
So,
Yeah,
um,
in Myrtle Beach also, that's when we developed this concept of the Better Bones community that we
right,
now have on
right.
Facebook. So
And
yep. Mhm.
no, it's just, and the community has grown with such great people there to, again, support, share
Yes,
your
yes.
story, and not feel alone. I think that I hear a lot from clients, I feel alone. I don't know where to go, but you feel better just to know there's other people
Yeah,
out
yeah.
there like you. So
And one of that's right. It was such a wonderful feeling of being able to help one another and empower one another, and that sense of community and even love, as you say. What I was really struck by with the retreats was all the women that were really willing to take a hard look at what's happening with their bone health and assess what they needed to change as far as their exercise, as far as their diet, as far as dealing with the doctors. They were willing to learn what they needed to say to the doctor, what tests they needed, how they could actually determine what was happening in their particular case. So it was such a nice mix of science and practical information, and also
yeah,
caring. It's really
yes.
lovely.
And you often say that we try to bring the care and health care, and
Yeah,
and we hear that I hear that a lot from clients. Like, I feel cared about, I
yeah,
feel
yeah.
nurtured and heard. But everybody just wants to be heard, and that's really important to
Yeah, yeah.
you
Everyone
know.
wants to be heard, but I'm sticking with a line that I want everyone to learn. There's no
Yeah,
reason that we should be fearful. And what I've dedicated myself to is the nuts and bolts of understanding what's going on. This is what I do with every client, but it's kind of expensive to see me individually. So you can do this retreat, and we'd like you to share it with all your friends, anybody who's interested in bone health. This is the world's greatest opportunity to learn every single thing I know and to get all the materials. It's just going to be an excellent offering. In fact, let's have we've had so many wonderful testimonials on the retreat, but I'm going to share just a short one from Sue Concrete, who was at one of our retreats, and she just couldn't. She represents the kind of feeling we have at this retreat and the value to it.
Truly, from the bottom of my heart, I want to say thank you to you, because this really was a life changer. I don't even have any fear whatsoever anymore. It's just a lifestyle, and I'm on with my life, and I don't even worry about my bones anymore.
Susan, so you attended our very first retreat in Myrtle Beach. Tell me a little bit, why did you go to the retreat?
Well, to be honest, I was just frightened. I'd been diagnosed with osteoporosis, and of course, my doctor was trying to talk me into bone drugs.
Mm-hmm.
And I'd even been turned down for long-term health insurance, or because of the osteoporosis, long-term care insurance.
So you were frightened. And when you got to the retreat, how did you feel? What feeling was there at the retreat?
Immediately I knew I was in the right place. It was very supportive. I was surrounded with people who had similar concerns. I just knew that I had arrived in the right place. It was not only you, but it was your entire staff, and they're just so knowledgeable and caring and passionate. And that passion, I felt, I wasn't another number. It wasn't just like another program. You all were passionate about each one of us, about our success, not only during the retreat, but after. I know that the support is always there, and the resources, whether it's a coaching session or hours with Dr. Brown. And that means a lot too.
So I felt really good. Felt good.
Yeah.
Great. And if you say it was like a 4-day event, what were some of the highlights of what you learned, the benefits?
Well, what I would say to anyone who's considering this is that it's not just a one size fits all, that you worked with each of us before, during, and after to help us understand our own situation. And so I learned a lot about my own bone turnover and the way I could slow some of that turnover down, and I could actually build the activity of the osteoblast and of the bone itself. Ways to change my diet to make it more alkaline,
Right.
Ways to supplement so that I would be sure to have all 20 of the essential nutrients, exercises I could do that I actually like to do, a very holistic program. And the other thing I would say is that you have a scientific mind. You are so knowledgeable about the research and what's coming, all the new research. And you share it in a way that even those of us who aren't so scientific understand and are motivated by it. There's a great balance between the scientist and the sage of the ages.
Hey, and so if one of your friends said, hey, should I take this retreat? What words of inspiration can you give anyone thinking about joining this retreat?
I would say, don't miss it. I think about it almost daily. You've changed my mind. I feel so empowered. I know that I'm absolutely making a difference with all the changes I made. I even see it in my skin and my hair and my nails, my gums. And so, especially with it being virtual, no travel, meeting people from probably around the world, I'd say don't miss it. It's a life changer.
That's perfect. Thank you, Sue.
Hey, that was great. Sue really, I thank her so much, because that is essence what we're doing. So now people are asking in the comments, are saying, well, I would love to go to an in-person retreat. Well, we're not doing it in person. Yeah, in person is lovely, but we're not doing it because of COVID.
Right.
And then we also realized when we started getting it together, we said, how can we deliver this information to the most number of people? And we realized we could do the same retreat online. We can have our breakout groups. We'll still be able to develop community, but it's going to be very inexpensive. Someone wrote in the chat, they wanted to know the cost. It's going to be it's if you do the early bird special, it's $249 until April 18th, and then after that it's $299.
Right.
As I was telling people, this is the equivalent. This retreat is the equivalent of 8 sessions with me,
Right.
at the less than a cost of even one single session. So it's gonna, even though we all love in person, it's going to be a great opportunity, and we hope that everyone will take advantage to share this knowledge. I often say you got to step up and learn, or you're going to end up on bone drugs, because that's just the way the system is going. So build bone strength, lifelong bone strength. We'll all be better.
It's also exciting, we are offering this virtual retreat. This is giving us an opportunity to reach people all over the world to connect together. And it's going to be recorded, so you can actually reflect upon it and replay it and have it as kind of a resource available to you. Plus, you're going to get a binder full of all of the information, and you can send in your bone densities in your labs and have a personal workup that we'll send to you. So, I mean, such valuable information. And we're going to have fun. We're going to exercise, and we're going to talk to each other, and we're going to laugh, and, it's going to be great.
It will be a fun thing. And someone writes and says, will there be any question and answer? Well, she said, will there be a question and answer every day with Dr. Brown? There will be question and answers. We will not leave one question unanswered. Truly, I want you to understand, my goal is to change the way women are treated around bone health. And we have to do that one by one. Each woman has to become empowered. There'll be time to ask questions. Several people are asking, will there be time to ask questions? You can ask questions of me. You can ask questions of Gina. We'll be all available for that. Someone asked, it's going to be recorded, and it will be recorded I have many times signed up for webinars that were like a series of 5 or 6, and I knew I couldn't do them all, but I signed up and then I go back and look at them when I have time. This will be a resource that can really, really help you over and over again.
So I know somebody asked how many hours per day, and we do have a set schedule. I'm not sure of how many exact hours it is, but we're trying to accommodate different time zones and groups of people. And if you can't attend live for one of the sessions, again, it is recorded that you can reflect upon. But I believe somewhere between 10 to 7 Eastern Standard Time is generally the time frame.
Yeah, and we have the schedule. Someone just posted the schedule, actually, and it's online. We have a lovely printout of all the sessions, the topics, the 6 steps, the 7 steps of the Better Bones, Better Body program, and so you can print this out, but it's online, and people wanted to know about the time to ask questions. There'll be plenty of time to ask those questions. What else was I going to say, Gina? There's something really...
Well, what are some topics? Well, can we discuss some general topics? People want to know about,
well, this
exercise, bone jugs.
This can be a quiz. This can be a quiz because the retreat is going to start out. Actually, we're going to cover every step of the Better Bones, Better Body program. We're going to start out with assessment. How you're going to have sent us maybe your vitamin D test, hopefully your bone densities. We're going to chart them out. We're going to assess your case. I'm going to teach you how to judge if your bone loss is excessive, how to judge if you're really at serious risk of fracture, and then what to do about it, including which tests to ask your doctor for. There's going to be a checklist of these tests. As we're going through this retreat, you can say, yes, I really need to ask my doctor for this test. I need to ask my doctor for that test. And remember, the goal of all this is to build better bones and a better body. So it's not just about bones, but we want to know, is there inflammation in the body as a whole? We want to know, is your vitamin D level really optimum? We want to know, are you losing calcium in the urine? Assessment is the first step. That's the one I love. Everyone else loves. Most people love things like Gina, exercise. Exercise is very popular. You're going to see Gina every day, several times a day. We're going to have breakout groups. And the breakout groups are going to be the same people, hopefully. So you'll maybe be with 6, 7 people, and you're consistently with them over the session. So you develop these bonds and these friendships that way. So assessment, then we're going to, of course, do exercise. Very important. I'm going to teach you about the new studies showing you can actually reverse osteoporosis with exercise, and it's been done at the Australian Bone Clinic. And we're going to be talking with those researchers also very soon. And then, of course, we deal with the alkaline diet. The alkaline diet is a cornerstone to building lifelong bone health, to maintaining muscle, maintaining bone strength as we age, and maintaining mental acuity, also very important. And then we're going to talk about stress reduction. Over the years, I've found that worry and fear is a major cause of bone loss. And now scientists are writing about this. I'm going to present the new data on how fear affects bone. And Gina and I will both help you with fear reducing techniques like meditation, pranayama, breathing exercises, physical exercises, a variety of things you can do to tone down that fear and to build the strength of your parasympathetic nervous system. And so every single step of the program, including, of course, the nutrients. People come to us. Gina spends all her day, much of her day, helping people sort out how do they use the nutrients. If you have poor bone health, if you have a concern for bone health, if you have a low bone density, it's likely you have a situation called repair deficit. The body is not repairing sufficiently. And for that, we need to really rebuild the digestion. And actually, we have a whole series of lectures on digestion. And we need to get the proper nutrients in the proper form. So we're going to talk about the nutrients. Each of you I will look at your situations and we'll show you the nutrients we use in the Better Bones, Better Body program, just as if you were an individual client. So we're going to do the supplements, the digestion, the stress, the exercise, the assessment, the alkaline diet. We're going to do it all, and we're going to have a good time.
So yeah, very exciting. Very excited to, get everyone together to share this information, to meet everybody.
Exactly,
It's gonna be fun.
and it'll be ongoing. We'll have that community. The Better Bones community will serve as a link. Perfect. Let's see if there's any last questions before we go. Someone wants to know if they can't attend all the sessions. Of course, they'll be recorded. You can have them pick them up whenever you want to do it. Someone asked, will the in the future, will we have in-person retreats? We certainly look forward to that. We, as you see by Gina's smile, we love doing that. However, we will do it, but it's much more expensive. I mean, it's thousands of dollars to do an in-person retreat, where this is a very tiny $250 if you do it now. So the fun thing would be do it now, learn everything, then come to the retreat. We'll find an exotic place to do it, and we'll have fun. And you can review all the elements, but you can also enjoy a vacation away from home. Right now, this is like a little vacation at home, your opportunity to step up to the bat and take charge of your bone health. I guess I don't want it ever said that anyone can say, look, I didn't know better. I see people coming to me every day say, I took this bone drug, I had these bad effects.
Oh, yeah.
I wish I had known better. Well, I don't want anyone to say that I wish I'd known. Everyone who's interested, this is an opportunity, and it's very affordable. It's our gift to you, and we hope that everyone takes advantage. What other questions we got, Gina, before we sign off? Will I have anything to follow along with, a notebook or a course guide?
Yeah. We'll have a great binder that we're putting together specifically for all of the attendees that you will receive beforehand. So, and you'll be able to keep that binder as a resource, as well as the recordings. So you're going to get also an alkaline diet starter kit too.
Oh, right. Yeah, because the diet's so important. We're gonna give the starter kit, which is like, I don't know, $40-$50 value, just because we want you to be able to measure your pHs before you come, so you're really prepared to use it. That binder will have all of the worksheets. It'll have the slides. It'll have much of what we talk about. So it's really, and we're going to mail that to you, which is unheard of. But we really want everyone to be empowered. Let me see if there's any other questions. So again, if I can't make all the sessions, there's no problem. You'll have it on film. Will there be a chance for me to ask my specific questions? That's for sure. Great. Okay, so we're looking forward to meeting you. If you have any questions, call Gina. If you say, look, this or that, I have a question about the retreat, give her a buzz. We'll list the phone number right here. In the meantime, go to betterbones.com. We look forward to seeing you, and we look forward to a day when no woman has to be afraid that she is going to be forced to be put on bone drugs, or that she's going to be overly concerned about her bone health without really understanding what's going on. Gina, thanks a whole lot for being with us.
Thank you so much. It's a pleasure to share this with you and with all the women out there, and men. So.
And yeah, we do. Yeah, don't forget the men. That's very interesting. We see several men. Okay, it's our pleasure. We hope to see you all soon. Take care. Have